They could be going for broke with their proposed fee increase already approved by their Board of Trustees in their fiscal year 2014 budget. With more on today's public hearing, here's Crystal Paco.
A trip to the emergency room for a broken bone would cost double if proposed fee increases on all services take effect. The numbers at a glance, your bill would reflect a whopping $500 from the original, $71 to visit the ER, $82 compared to today's $70 to send your x-ray to radiology, another $50 from today's $28 to have a radiologist review your x-ray, and lastly $336 in ER doctor fees compared to today's $250. But the island's insurance companies aren't buying it and vocalized opposition at today's public hearing. Staywell Insurance's Francis Santos.
There's some really outrageous fees, and this will definitely impact our rates on what we offer to our groups out there in the private sector, and also in the government sector, because now Staywell is now one of the plans that's being offered to government employees.
Take Care's Tim Ogata says it's too much, too fast. Ultimately, Ogata predicts the end result would be most detrimental to the hospital itself.
In turn, less people are going to be able to afford that rate increase, right? So they go to the uninsured side now, and that's going to hurt our GMH community as well.
But GMH Chief Financial Officer Alan Ulrich ensures they're not out to target insurance companies.
We are not looking for the insurance companies to cover the full cost. No, you're 25% of our business right now. In our revenues that we projected for 2014, insurers were only assuming 30% of the increase. We are not looking for you. We are looking at Medicare going up $5 to $10 million. We're looking at Medicaid and MIP going up to $5 to $10 million. We're looking at collections of self-pay going from $3 million to $6 million, $7 million.
GMH Administrator Joseph Verga has also considered the doomsday scenario as the Guam Regional Medical City is set to open doors next summer. He anticipates the for-profit hospital's fees to reflect that of a mainland hospital's.
Even if every insurance patient that we have goes to GRMC, I mean, that's about $30 million or so in revenue a year. They're certainly not going to exist at a private hospital where they have to pay investors on $30 million a year. But more importantly, with a private for-profit hospital, their charges, I just throw out a rhetorical question, do you think their charges are going to equate to GMH's charges now?
Using the recent implementation of the Guam Power Authority's smart meter as an example, Vice Speaker B.J. Cruz hopes GMH will do a better job at cleaner billing.
I complained about my rate going up, and one of the CCU members brought me down my sheet, and he broke down every single thing, what in the house was using what, and that's what I'm saying. Get it so that you have a clean bill, so there's no question about where and what is being charged.
Reminding today's attendees that the legislature remains committed to recovering the hospital's flatlined finances. Committee Chair on Healthcare, Senator Dennis Rodriguez Jr.
I think it's very important to note that in the 2014 budget that was just signed into law, this is probably one of the first times that the government, the legislature, has recognized and said, you know, we need to increase the funding to the hospital.
The GMH Board of Trustees will review the fee-setting methodology and fees at its next meeting on September 26.
Ultimately, what we bring to you may have a different face than it does now, and we certainly will take what you said to heart, go back to the drawing board and give it some more thought.
Reporting for Guam's News Network, I'm Crystal Paco.